Hello, my dear students. I am Associate Professor of Department of Human Anatomy and Medical Terminology of Azerbaijan Medical University, Anar Abdullayev. And the topic of our today's lecture is a functional anatomy of genital organs, their development, variations, and anomalies. Classification of endocrine glands, development of endocrine glands in ontogenesis, and their peculiarities. As always, I have prepared a special plan about our today's explanation, which will help us to understand the main moments of our today's lecture. First of all, I'll talk about the functional anatomy of the genital organs, their development, variations, and anomalies. Then, the second part of our lecture will devote to classification of endocrine glands and their development of endocrine glands. The genital organs, you have had many practical lessons about the genital organs, and as you know, the genital organs are divided into the male and the female genital organs, and subsequently these organs are divided into the internal and external genital organs. For example, in males, the internal genital organs include the testes. These are the paired sex glands, both exocrine and endocrine function. Epididymis, here is the epididymis. Vas deferens or the ductus deferens. Seminal glands, prostate, and the bulbourethral glands, or the glands of Mary or Cooper. To external male genitalia belong the penis and the scrotum. First of all, in this picture you are looking at the external male genitalia from ventral aspect. Nerves and the vessels exposed by extensive removal of the skin and the superficial fascia of the penis. The layers of spermatic cord have been incised on the right side, and note the pampiniform venous plexus surrounded the testicular artery. It's here. Again, the external male genitalia from ventral aspect, the skin of the abdomen and the parts of the skin of the scrotum have been removed, and the body of the penis has been severed, revealing the internal structures of the penis, like the cavernous bodies and the spongy body, cavernous bodies and the spongy body of the penis. The layers of the spermatic cord and the coverings of the testes have been dissected on the right side. These are very important moment, the coverings of the spermatic cord and testes. I'll explain it slightly later. As you know, the testes, also the ovaries, genetically or developmentally are organs of abdominal cavity. But during the intrauterine life, they descend the ovaries till the lesser pelvic cavity, but the testes, both testes, they pass through the inguinal canal, and they reach the special sac, scrotum. This process is normal and is called the descent of testes or descent of the ovaries. But during this process, the testes with its coverings also descend into the scrotal cavity, and it means the organs or the parts of the layers which are known, for example, in abdominal region, like the fascia superficialis, superficial fascia, or the fascia transversalis, transverse fascia, they change their name and they will call them by another way. It's very important moment for understanding the coverings of the penis, covering of the spermatic cord and the covering of the testes. Here's the testis. The testis in the several sections. It's egg-like structure. It has the lateral and the medial surfaces, anterior border, which is free, and the posterior border is occupied by the epididymis. Testis is covered by the tunica albuginea. The importance of this tunic, of this coat, I also will explain this slightly later, but I want to explain the moments which we will develop the further. It's the mediastinum of testis and the formation of the testis septula, because the testis is covered by the tunica albuginea, is the dense connective fibrous tissue, and on posterior border of the testis, this tunica form the thickness, the mediastinum testis, and here and also here. From the mediastinum, 2 or 3 hundred septulae or septations originate, and they pass into the mass of the testis, and they divide the mass substance of the testis into the 2 or 300 lobules. The testis and the scrotum. In this picture, you are looking at the preparation, the testis. Also, the scrotum is dissected, and you are looking at the testis with its coverings, and you are looking at ductus deferens, and which passes to the spermatic cord. The testes are contained in the scrotum, the pendulous sac that keeps them at the low temperature needed for the spermatogenesis, because the main function of the testes is the producing of the spermatocytes. It's the very difficult, very complex process, and for this process, for their organization, for the spermatogenesis, the testis needs the low temperature, lower than the in abdominal cavity. The thin skin of the scrotum is continuous with the skin of the, of course, the lower abdominal wall, the upper thigh, and the perineum. The scrotal skin, which will divide, is more or less wrinkled, and the wall scrotum is more or less compact, depending on the action of the fine layer of the muscle. It is the dartos muscle that lies just beneath the skin. The spermatic fascia. The spermatic fascia, there are the external and internal spermatic fascia. The external spermatic fascia is the continuation of the superficial fascia of abdomen, because I have explained, I have noted about it that during descending process, testis also takes its coverings, and it descends, it goes downward with these coverings, and the superficial fascia then transforms in the scrotal cavity into the external spermatic fascia, and the transverse fascia, it transforms to the internal spermatic fascia. The testis is surrounded by a thick layer of the loose connective tissue. Of course, it's not so dense, the spermatic fascia, that's formed by fusion of two developmentally distinct layers, the internal and external spermatic fascia, that are derived from the different layers of abdominal wall, which was, I have explained before, it's the superficial fascia of abdomen, and the transverse fascia of abdomen which is the more thicker than the superficial one. The tunica albuginea, this is the dense connective tissue, blue-white layer composed primarily of collagen fibers. It covers the tunica vasculosa and is surrounded by the visceral layer of the tunica vaginalis. What is tunica vaginalis? It's the derivative of the peritoneum. It's the derivative of peritoneum, and it's the very important processus vaginalis, which is formed during the descent process, descending of the testis. At the posterior aspect of the testis, it projects inwards as a thick but incomplete fibrous septum here. Mediastinum testis, which extends from the upper to lower pole of the testis. It's here that vessels, nerves, and the testicular ducts traverse the testicular capsule. And the parenchyma of the testis, which is formed by the two, maybe 300 lobules, and each lobule consists of 2 or 3 convoluted tubules. What does it mean, convoluted tubule? It means that these tubules are so coiled, and the spermatogenesis happens in this layer and only in this layer, in convoluted tubules. There are 2 or 3 convoluted tubules in each testicular lobule. But near the mediastinum, they make the anastomosis and transforms to the tubuli recti, the straight tubules. And the number of the straight tubules is equal to the number of the testicular lobules. Here you are looking at the seminiferous tubules. As I have noted, they can be convoluted or coiled. There are 2 or 3 in each lobule, and they can be straight. They can be straight or the tubuli recti. Tubuli recti, then near the mediastinum, they form the rete testis, special testicular network, and from this network originate the between the 12 to 15 the efferent ductils. Efferent ductils, ductuli efferentis, enters into the epididymis, and they form the head of the epididymis. Head of the epididymis, for comparison, I can say that these tubules, I mean the convoluted tubules, they are so coiled. If you want to know the length of these tubules, the common length of this tubule is equal to 250 meters. But the convolutions give them the chance to locate within the testis, which has the length is equal to 4 centimeter, length 3 centimeter the breadth, and 2 centimeters the anterior posterior diameter of the thickness of the testis. And the tunica vaginalis, which I have informed you before, it is the derivation of the peritoneum. The tunica vaginalis is a continuation of the peritoneal processus vaginalis, whose formation precedes the descent of the fetal testis from abdomen of the scrotum. Primarily, we will get the tunica processus vaginalis, which is then give rise to the tunica vaginalis. Following testicular migration into the scrotum, the portion of the processus vaginalis that falls between the internal inguinal ring and the testis contracts and is obliterated, leaving a distal sac containing the testis. It's very important moment. Just after the sending of testis into the scrotal cavity, any connection between the scrotal cavity and the peritoneal cavity, becomes to nothing. It's absent. But if presents any connection, it means it leads to the congenital inguinal hernia. Okay, of course, failure to obliterate the processus vaginalis result in a persistent communication with the scrotum and the peritoneal cavity and indirect inguinal hernias. You are looking at the tunica vaginalis, the parietal layer, because it's the derivation of the peritoneum. And as you know, the peritoneum is divided into 2 layers, the parietal and the visceral. And in scrotal cavity, like the peritoneal cavity, the tunica vaginalis divides into 2 layers. One of them that covers the scrotal cavity from inside, it's the parietal layer. Next one, that covers the testis from outside. It's the visceral layer. And please look at the connection with the epididymis, with testis. Here you are looking at the superior ligament of the epididymis and inferior ligament of the epididymis. Also, you can find on the testis, on the surface of the testis, also on the epididymis, some rudiment structures like the appendix testis in this picture. It is a derivative of the paramesonephral or Wolffian duct. During our last lecture, which was devoted to the development of urinary organs, I told about the Wolffian duct and the Mullerian duct, or the mesonephral and the paramesonephral ducts. Mesonephral duct, which is important in development of the many male genital organs, but in future female, I mean the fetus, with the development of the female sex features, the Wolffian duct must be reduced, but Mullerian duct develops. Mullerian duct or paramesonephral duct develops, giving rise to the uterus, uterine tubes, also vagina, but in the male sex this duct is reduced, but it's not completely reduced. It's not completely reduced. It gives us the appendix testis, just this structure, and also within the prostate gland, the utriculus prostaticus, or the utriculus masculina, also the derivative of paramesonephral duct or the Wolffian duct. We are looking again at the testis, the epididymis, and from the lower end the curls around the testis, and gives rise to the vas deferens or the ductus deferens. But we are interested in the mass, in the organization of the substance of testis. And there are two very important and very interesting cells here, group of the cells, the Sertoli cells and the Leydig cells. The Sertoli cells, they are here, provide the key support for spermatogenesis within the seminiferous tubules. How? Consistent with their phagocytic function, their cytoplasm is rich in lysosomes. In addition to their role in spermatogenesis, Sertoli cells secrete proteinous fluid to facilitate spermatozoal transport through the seminiferous tubules and into the excrement ducts. They also regulate the intratesticular hormonal milieu by secreting inhibin B and androgen binding protein in response to stimulation by pituitary or the hypophyseal gonadotropies, which is very important because they consist of the special receptors for understanding, for receiving this stimulation. And the Leydig cells, they are also here. Leydig cells or the interstitial tissue. The interstitial tissue between the seminiferous tubules includes of course the peritubular myoid cells, the vessels, nerves, and the clusters of the Leydig cells. As any other place, the myoid cells are contractile. Their rhythmic activity helps propel non-motile spermatozoa through the seminiferous tubules towards the retestis and the excurrent ductal system. Leydig cells are large polyhedral cells with eccentric nuclei containing 1 to 3 nucleoli and the pale staining cytoplasm containing the smooth endoplasmatic reticulum, lipid droplets, and characteristic needle-shaped crystalloid inclusions, crystals of Ranke. In response to stimulation by pituitary gonadotropins, they synthesize and secrete the testosterone. It means they act as endocrine organ. And here you are looking at the epididymis. Here's the position of the epididymis with the coverings, the head of epididymis, the body and the tail. As I have noted, the tail then curls around and form the ductus deferens. The epididymis lies posterior and slightly lateral to the testis. As I have noted, anatomically it is divided into three sections: caput or head, corpus, and the cauda. Between 8 and or 12, but mainly between the 10 to 15 efferent ductules from the superior pole of testis drain into and they form the caput epididymis. Distally, the cauda epididymis becomes continuous with the convoluted portion of the vas deferens. The epididymis is invested by tunica vaginalis, continuous with that covering of the testis. Laterally, a drip groove, the sinus epididymis is here, marks the boundary between the testis and epididymis. Example here and in this place. And in this picture, it's enlarged this place for observation of the efferent ductules. Testis epididymis non-fusion has been described in children with cryptorchidism. Non-fusion may involve the epididymal head or tail or the whole epididymis. Also, on the head of the test, we can find the appendix epididymis, and just behind the head of the epididymis, also you can observe here the paradidymis. These two structures all are also rudimentary, and they are derivatives of the Wolffian body, not Wolffian duct, Wolffian body. But efferent ductules also are derivative of the Wolffian body, but they are functionally normal structures, and the male genital system needs these structures because after the rectal testis, they originate from the rectal testis, and they gives the development, gives the main mass for the head of the epididymis. Here's the vas deferens, or the ductus deferens. The length of this duct is between the 45 till the 60 centimeter, is a tubular structure derived from the mesonephric duct. Yes, its primary function is the transport of sperm from the epididymis to the urethra. Also, absorptive and the secretory function have also been described by the new investigations. It's not just a tube, because the spermatocytes which are produced within the testis, they are much more by the number, but they are non-active structures, and for activation they need the other fluids. They need the other juice, for example the secret of the seminal vesicles, secret of the prostate gland, and here's the spermatic cord and the ductus deferens, which is from the one of the important parts of the spermatic cord, also take place in this secretion. As it arises from the cauda epididymis, the vas is tortuous for 2-3 cm. Beyond this convoluted segment, it lies posterior and parallel to the vessels of the spermatic cord, passes through the, of course, inguinal canal, and emerges in the pelvis lateral to the inferior epigastric vessels. At the internal inguinal ring, the vas diverges from the testicular vessels, coursing medial to the structures of the pelvis side wall, in order to reach the base of the prostate gland posteriorly. Here the vas once again becomes the tortuous and dilated, from the ampulla of the vas deferens, before culminating at the ejaculatory duct. You are looking in this picture at the ampullary part of this duct. On each side of the ductus deferens widens out to form the ampulla where the spermatozoa are stored. Lateral to the ampulla on each side is the seminal vesicle. The length is 5 centimeter, the width is the 2 centimeter. It's not just sac, it is the gland. It is the gland, and it's secret just for activation, of the spermatocyte. The seminal vesicles produce a nutrient liquid that forms much of total volume of the seminal fluid. The walls of the ampulla and of the seminal vesicle are formed largely of the thymous muscle. When these contract, the contents of both chambers pass together into the ejaculatory duct. And you are looking at the cross section of the penis. There are two spongy corpus spongiosum is here, and the cavernous bodies are here. Along most of its length, the penis seen here in cross section consists of the three somewhat cylindrical masses of highly expandable tissue. On each side are the corpora cavernosa, these two ones, and the singular of which is the corpus cavernosum. The corpora cavernosa are the main erectile bodies of the penis. They are contained within a strong layer of the fibrous tissue, the tunica albuginea. Within this, there is a continuous space intersected by open network of the fibromuscular tissue. The space is filled with blood, like in this picture. A little when the penis is flaccid, much more when it's erect. The two corpora cavernosa are separated but by the incomplete septum. Running along the underside of the penis is the corpus spongiosum, which is the continuous proximally with the bulb of the penis and distally with the glans. And you are looking again at the male urethra. As you know, the male urethra explains the very close relation of two systems. They are genetically close relation of urinary system from one hand and the genital system from the another hand. And this duct, this the part of urinary and also taking place in genital system, male urethra has the two curvatures, one of them behind then the pubic symphysis, next one under the pubic symphysis, and again you are looking at the bodies of the penis. For repeating the male genitalia, seminiferous structures, a view of the seminiferous structures, anterior view of the male reproductive tract. The bladder is also shown to aid orientation. Very important note, the male uterus serves as a common urinary and the genital passage. The vas deferens and the duct of the seminal vesicle join to form the ejaculatory duct, which opens into the urethra, here the ejaculatory duct, and also prostate gland has the special prostate gland has the own ducts for the formation, the special pH of the sperm and or the special smell of the characteristic smell of the sperm. Developmental anomalies of the testes, as you know, the main important and complex the moment here, the process of the descent of the testes. This process begins by development of the Wolffian duct. The Wolffian duct develops before than the male genital organs, and during the first period, the early period of the embryonic life, the rudiment or the main source of testis is located at the cervical region of embryo. But very soon the cranial part of this origin becomes to reduce, but it grows distally, and it grows distally. It means by the development of embryo, the testes are located step by step at the lower part of the embryo, and they reach the level of the lumbar segments. And at the 6 months of the pregnancy, the processus vaginalis is formed by the peritoneum at the deep inguinal ring, and at the 7th, 8th months of the pregnancy, the testes pass through the inguinal canal and reach the scrotum. Of course, the main moment, the main difficulties, of course, are happened here. Maybe testes, both of them or the one of them couldn't descend, or it descend but couldn't reach the point of destination. Under the point of destination, of course, I meant the scrotum. Testicular descent from the abdominal cavity to the scrotum may be arrested at any point along its course at the deep inguinal ring, in the inguinal canal, or between the superficial inguinal ring and the scrotum. Retention in the inguinal canal is associated with a patent processus vaginalis and may be further complicated, as I have noted before, by a congenital hernia. Occasionally, the testis may migrate outside its normal path of descent and lie in an ectopic location. Ectopia, it means the ectopy, when the organ must locate in this point, but it's located unusual, it's located in another cavity, another place. It's ectopy. At birth, the 3% of full-term male infants have a unilateral undescended testis. By 6 months of age, this number, of course, decreases to less than 1%. Undescended testes are associated with a higher risk of infertility and testicular cancer later in life. In contrast, small descent in children between the age of 1 and 15 years is associated with Sertoli cell degeneration. Again, the clinical anatomy of the testes, the normal process, and when there is the connection between the peritoneal cavity and the scrotal cavity, the fluid can pass into the firstly between the layers of the spermatic cord, and secondarily it can reach the scrotal cavity, form the spermatocele or varicocele. Spermatocele in this picture, here, and varicocele in this picture. Also hydrocele, like in the testicular cavity, you are looking at it, hydrocele, and the many moments of the cryptorchidism. It can be unilateral or the bilateral process. And by the number of the testes, if the one of these origins undescent, or we are talking about the cryptorchidism or the testicular retention. But if there is no any origin for the testes, or the simply saying we can't find the germ of testes, it means that one of them doesn't develop, just uni moment, just only one testis, or the another accessory testis, the 3 testes can be developed. It's the anomalies which are depending on the number of the testes. And again, the testis is formed by the convoluted seminiferous tubules. They are important for spermatogenesis. Straight seminiferous tubules, rete testis, efferent ductils. Efferent ductils are the derivative of the Wolffian body. Epididymis is formed by the head, body, and tail. Head is formed by the efferent ductils open into the epididymal duct, and within the body and the tail we will find the epididymal duct. Epididymal duct is derivation of the Wolffian duct, not body, Wolffian duct. And the inguinal canal and the pelvic cavity, here we can find on the vas deferens. Prostate, here is opened the ejaculatory duct, union of the ampullary part of vas deferens and the duct of the seminal vesicle. Pelvic floor and the pelvis, it's for the urethra, which mainly belong to the urinary system. And again, you are looking at the male urethra and the structure of the penis with the blood vessels, with the arteries and the venous vessels. The scrotum, which I have explained before, it also is belong to the external genital organs. And the female genital organs, mainly we can observe here the same rule of the organization. The gland and the system of ducts for conducting, for carrying the oocyte from the ovary to the external openings of this system. Female genital organs, the internal genital organs mainly are here. These include the ovaries, also the uterine or the fallopian tubes, uterus and the vagina. Uterine tube, for beginning, is the fallopian tube in cross section. Like the uterus, the uterine tubes are intraperitoneal organs, but we can't say the same thing about the ovaries, because yes, they are located, totally located within the peritoneal cavity, but the peritoneum doesn't cover the ovaries. The fallopian tube or the uterine tube in the cross section view of the ampullary portion of the right fallopian tube. The mesosalpinx, this is the intraperitoneal organ, and the peritoneum form the mesentery for the uterine tubes. Salpinx is the Greek name of the tube, and the mesosalpinx extends inferiorly. The three wall layers are clearly distinguishable. The mucosa is raised into a great many folds that occupy most of the tubal lumen. These folds are of the key importance in transporting the zygote to the uterus. Post-inflammatory adhesions between the mucosal folds may hamper or even prevent transport of the fertilized ovum. The muscularis consists of the several thin layers of the smooth muscle that provide the fallopian tube with its motility and propel the zygote towards the uterus by a ciliated epithelium. The serosa, or the peritoneal covering of the fallopian tube, is continuous with the mesosalpinx. Here's the female internal genitalia, again the cross section of the ovaries, about the structure of the ovaries and the uterus. You are well informed during your practical classes. Like the testis, the ovaries also developed in abdominal cavity, but then they descend to the sense of the ovaries, but they only reach the pelvic cavity, the cavity of the lesser pelvis, they being located at the lateral wall of the lesser pelvic cavity with two ends. One of these ends faces to the uterus and connects with the uterus by the ligamentum ovari proprium. Next end looks to the uterine tubes, and the ligamentum suspensorium ovari also attached here. The ovaries in the preparation, and look at please the relation between the last part of the uterine tubes, the fimbria, which form around the infundibular part of the uterine tubes, and this fimbria are around the ovaries, and one of these fimbriae is elongated and form the fimbria for ovary, fimbria ovarica. The ligaments, which I have explained before, the two ligaments in preparation, proper ligament of the ovary and the suspensory ligament of the ovary. Within this last ligament there are many blood vessels which supply the not only ovary, also the uterine tubes, also the lower part of the ureters. It means during the gynecological operation you shouldn't ligate, you shouldn't close this ligament because it can lead to the necrosis of the ovaries. And the mesosalpinx I have informed you before. Meso means the mesenterium, and the mesosalpinx is the part of the peritoneum which attaches to the uterine tubes. Salpinx is tube. The mesosalpinx is attached above to the uterine tube and the posterior inferiorly to the mesovarium. Superior and laterally it is attached to the suspensory ligament of the ovary. Medially it is attached to the ovarian ligament. The fimbria of the tubal infundibulum projects from its free lateral end. Between the ovary and the uterine tube, the mesosalpinx contains the vascular anastomosis between the uterine and the ovarian vessels. And also within this element, within this anatomical structure, two rudimentary elements of the female genital system, epoophoron and the paraophoron. They are derivatives of the Wolffian, of course, the Wolffian body and the Wolffian duct, which are reduced during intrauterine life in future girls. The mesotherium projects from the posterior aspect of the broad ligament of the uterus, of which it is the smaller part. It is attached to the hilum of the ovary and carries vessels and the nerves to the ovary, of course. Here is the broad ligament, the broad ligamentum latum uteri. It's the derivation. It's the very large derivation of the peritoneum. Very important. It covers the uterus from back side and from the anterior side, making the uterus the intraperitoneal organ. The lateral folds or broad ligaments extend on each side from the uterine to the lateral pelvic walls, where they become continuous with the peritoneum covering those walls. The upper border is free and the lower border is continuous with the peritoneum over the bladder, rectum and the side wall of the pelvis. The border there continues with each other at the free edge, while the uterine fundus is formed at the age of 6 or 7, but they can also don't develop. It don't develop if the fundus it leads to the formation of the anomaly shape of the uterus, bicornate, two-cornate the uterus, because there is no fundus. And uterine tubes lies in the upper free border of on either side. The broad ligament is divided into an upper mesosalpinx, a posterior mesovarium, and an inferior mesometrium. Ovarian cycle, you are looking at the formation of the from primary ovarian follicles, the secondary ovarian follicles formation, the liquid within this system, within this follicle, and then the rupture of the follicle and the releasing of the oocyte with the special cells like the corona is formed around this oocyte, and it is freely located for the several time on external aspect of the ovary, and then will be catched by the infundibular part, strictly saying by the fimbria of this part. You are looking again at this picture, and on the development from oocyte, the primary follicle, within oocyte within the follicle, formation of the granular cells around the follicular follicles from inside. And you are looking at the topography of the uterus. It is located between the urinary bladder and the rectum. During our lecture, which was devoted to the development and topography of the peritoneum, I have explained here that there are two excavations, one behind and next one in front of the uterus, and the first one is the deeper, from the two spaces, two cavities of Douglas, and the posterior excavation, anterior excavation, and it leads to special sexual difference between the peritoneal topography in the men and women. And again, you are looking at the structure on the preparation, the uterus with the uterine tubes and the ovaries, the relation of the uterine tubes to the ovaries. Again, in this model, we are looking how the oocyte passes through the uterine tube by the movement of the ciliary epithelium of uterine tube epithelia from the abdominal ostium to the uterine ostium. Again, in this picture, you are looking at the model, and in the cavity of the uterus, it's a highly vascularized structure. The uterus and the very thick layer of this organ is the muscular layer. The longest smooth muscle elements we can find in the uterus, in this organ. And about development, I have told you that the Wolffian duct is the main source of development of many important male genital organs. At the same time, the Mullerian duct also the source for development of the female genital organ. And also, I said before that during early development, early embryonic stage, the indifferent sex glands, the indifferent, we don't know this is testis or the ovary, they are located at the neck region. Then they reduce cranially and develop the distally and reach to the lumbar region. And in this part here happens the followings. For example, around the epithelial cells, this is the coelomic epithelium of the gonads, the future testes or the ovaries, doesn't matter. The relation with the epithelium with the mesenchyme is important. Mesenchyme is important because in the future male genitalia, these elements, indifferent gland, they can contact with the elements of the mesenchyme and bind them with the Wolffian duct, forming the epididymal duct and then the vas deferens and so on. In female, in development by the female sexual way, it means that there is no connection, and the Wolffian duct will reduce, and the Wolffian body just give the only rudimentary organs of the female genitalia. Main source of development of the female genital organs is the Mullerian duct, but primarily at the lumbar region of embryo there is the indifferent gonads, the gonad primordium, and side by side located the Wolffian body and the Wolffian duct. At the fourth week of development, also Mullerian duct occurs here and form the plica urogenital fold. and they develop inferiorly. And as you know, the inner part of the embryo form the whole cavity, which receives the all systems, the digestive tube, also genital and the urinary tubes. But very soon, this cavity is divided into two parts, anterior and the posterior. Posterior part will belong to the rectum. Anterior is the urogenital sinus, and between them, between the primordium, between the germ of the umbilicus and the germ of the future thigh or the femoral regio, the external genital organs will develop, and there is the cleft, little cleft between them, the future on the urogenital diaphragm, which again it transforms to the urethra. And if we will look at it again, the metanephra kidney, mesonephros, it explains the very close relation in development between the urinary and the genital systems. And again, mesonephric duct, undifferentiated gonads, and it develops in the way of the testis, form the lobules of the testis, convoluted tubules, and straight tubules of the testis. But in female, it develops in different way. It forms the ovaries from the primary gonads, and from the paramesonephral or the Mullerian duct develop the uterine tubes, uterus, and the vagina. Develop of the genital organs again are here the undifferentiated gonads. You are looking at the plica urogenitalis, and the paramesonephric or the Mullerian duct, and the mesonephric or the Wolffian duct. You know from our lecture about the urinary system, the distal end of the Wolffian duct form the tubercle, urethric tubercle. It ascends to the lumbar regio for joining with the source of the final kidney, with the metanephros. And if we'll continue again in the development of the Sertoli cells here, the development of the Sertoli cells, and the mesonephric duct or the Wolffian duct is here, and testosterone is converted to dihydrotestosterone by 5-alpha reductase to action. Here's the development of the genital organs by under the control of the hormonal system. And development of the external genital organ, development of the genital tubercle, side by side develops the two swellings, which develop in the males into the scrotum, in female into the labia majora. And development of from the urethral tubercle, from the genital tubercle of the penis glands, and from the swellings develop the scrotum. And of course the anus at the posterior part, it corresponds to the posterior part of the common cavity, which I have explained the anomalies here. Again the anomalies, defective inguinal canal. About the endocrine glands, this is the very important system of the internal organs. As you know, the endocrine glands, they don't have the ducts. Glandulae sine ductibus. It means without the glands, without duct. And they are located in many places of the human body. They are located in the head regio, in the neck regio, for example, in the head, the hypophysis, also epiphysis. In the neck regio, it's the thyroid gland, parathyroid gland. In thoracic cavity, is the thymus, adrenal glands, also testes, which are located in the scrotum. They also have the endocrine function. The main features of these glands, first of all, they are very little by size, of course, and due the very active processes of synthesizing biologically active substances, these glands receive the very rich vascularization. They have the very rich vascularization. And also the main feature, they don't have the ducts, you know it, and they're producing by this duct the secret is called the hormone. Hormone is translated like waking up. Their morphofunctional features, of course, you are looking at the very rich, highly vascularized structures, and they are very small, very little structures, and of course the for example suprarenal gland is here, which the very little gland has three sources for vascularization: from the inferior phrenic artery, from abdominal aorta, and from the renal artery. It means that if they worked very intensively, they need the very rich vascularization. But classification of the endocrine glands is based on their development. It means the development from the embryonic layers, from the ectoderm, or from the mesoderm, or from the endoderm. From the endoderm, I mean the primary intestine tube. From here, the pancreas is developed. Ectodermal glands, they're glands which are developed from the primary nervous tube. I mean here the hypophysis, but on the posterior lobe of the hypophysis and the epiphysis. Also again the ectodermal glands, but they develop from the sympatoblast. For example, the paraganglionic cells or the medullary part of the suprarenal gland, they have the same structures like the sympathetic ganglia of vegetative nervous system. And we have the special generation of these glands which are developed from the arches, from the pharyngeal arch, and from the pharyngeal pouch. These are the thyroid gland, parathyroid gland, thymus, and the anterior lobe of hypophysis, or the adenohypophysis. You are looking again at this gland. For example, you are looking at the thymus, fork-shaped gland, and the hypophysis, which is developed from two sources. Adenohypophysis. Adeno means the glandular hypophysis. It's from the main mass of hypophysis. You know it from your practical classes. 70-80% of the hypophysis is formed by the adenohypophysis, and the adenohypophysis also is called the main regulator of the endocrine system, because it produces the trop hormones. It controls the thyroid gland, for example, but except the cells which produce the calcitonin. Also, it regulates the function of part of suprarenal cortex, and also it regulates the function of the sex glands. But how and which element does regulate the function of the hypophysis? Or mainly our body is regulated by humoral way, by liquids? No, of course. The hypophysis is under the control of the hypothalamus. There is the hypothalamo-hypophyseal way, and the hypothalamus, it has of course, it's the neural structure, has the neurocytes, neurons, but these neurons, group of these neurons, also have the endocrine activity, and they form the from your practical classes, the oxytocin hormone, and also they release the if factors, releasing factors. They stores from of course they produce in the hypothalamus, but then they store in the hypophysis, and after the accumulation of the releasing factors, hypophysis can regulate the function of other following glands, which I have noted before. The pancreas, which we explained before during our practical classes, suprarenal glands, the testis, Ovaries, the sex glands, also the coelomic glands that they develop from the mesoderm. Adrenal glands or the suprarenal glands, the cortical part develops like the mesodermal gland, but the medullary part develops from the sympathoblast. And you are looking at the system, these glands of the developing from the primary nervous tube. It's the hypophysis and the epiphysis. I mean, this thyroid gland, which is the very important and the pathological condition of this thyroid gland is very actual. Very actual, of course. Unfortunately for Azerbaijan also, because there are some districts in our country with the iodine defects, iodine the decreases in the main sources. In this moment we have the pathological conditions of the thyroid gland. Morphofunctional unit of the thyroid gland is the firstly described by the chief of department of human anatomy and the medical terminology of Azerbaijan Medical University, academic Shadlinsky, and he called this unit the thyromorphocomplex, or the simplest thing, thyroid. It's the group of the follicles with the basal membrane, with the collagenous fibers, and with the tissue basophiles. It means he explained that there is the two processes here: the folliculogenesis, the formation of the new follicles, and the follicular elimination, the connection of them, fusion. And the balance between these two processes is very important. For the normal regulation, normal functioning of organism. The thyroid gland, the convex lateral superficial surface is covered by the sternothyroid, whose attachment to the oblique thyroid line prevents the upper pole of the gland from extending onto the thyrohyoid. More anteriorly lies sternohyoid and the superior belly of omohyoid, overlapped inferiorly by the anterior border of the sternocleidomastoid. Because the operation, many operations have been provided in this gland, you have to know the topography of this gland very well. The medial surface of the gland is adapted to the larynx and the trachea. Yes. And its superior pole contacts the inferior pharyngeal constrictor and the posterior part of the cricothyroid, which separated from the posterior part of the thyroid lamina and the side of the cricoid cartilage. The external branch of the superior laryngeal nerve is medial to this part of the gland as it passes to supply the cricothyroid. Inferiorly, here, the trachea and the more posterior, the recurrent laryngeal nerve and esophagus, which is closer on the left, are medial relations. The posterior lateral surface of the thyroid gland is close to the carotid sheath and overlaps the common carotid artery. Here is the thyroid gland, and there are two main forms, two main shapes of the thyroid gland, with two lobes, bilobated, and with the third pyramidal lobe, which can observed in 30, maybe 35% of the cases. It's the remnant of duct, pterioglossal duct, because the source develops on the point of the foramen succum of tongue, and it descends inferiorly, but if this descent process is not completed, the third lobus pramedialis is formed. The parathyroid glands here, the superior parathyroid glands are more constant in location than the inferior and are usually to be found midway along the posterior borders of the thyroid gland, although they may be higher. The inferior pair are more variably situated, related to the embryological development, and maybe either within the fascial thyroid sheath below the inferior thyroid arteries and near the inferior lobar pulse, or outside the sheath immediately above and inferior the thyroid artery, or in the thyroid gland near its inferior pole, which is a very dangerous moment during the operation on the thyroid gland. By mistake, the surgeon can also cut or remove the parathyroid gland. A tumor of the inferior parathyroid situated within the fascial thyroid sheath may be descend along the inferior thyroid veins anterior to trachea into the superior mediastinum. It deepens the dangerous process, and whereas if it's outside the sheath, it may be extend posterior inferiorly behind the esophagus into the posterior mediastinum. The superior parathyroids are usually dorsal and the inferior parathyroids ventral to the recurrent laryngeal nerves. About the suprarenal gland, it has the cortex and it has the medulla. Cortex developed from the mesoderm and the medulla developed from the ectoderm. The cortical cells produce several hormones, and the cells of the fasciculate zone, zona fasciculata and reticularis, are also rich in ascorbic acid. Cells in zona glomerulosa produce mineral corticoids, exemplar gratia, aldosterone, which regulates the electrolyte and the water balance. Cells in the zona fasciculata produce hormones maintaining the carbohydrate balance, for example, glucocorticoids, cortisol, hydrocortisone, and the cells in the zona reticularis produce sex hormones like the progesterone, estrogens, and androgens. The suprarenal cortex is essential to life, and its complete removal is the lethal without replacement therapy. It exerts considerable control over the lymphocytes and lymphoid tissue, and increased secretion of the corticosteroid can result in a marked reduction of the lymphocyte numbers. About the medulla, the suprarenal medulla is composed of groups and the columns of chromaffin. They are good stain in the chromaffin cells and chromaffin cells, and separated by wide venous sinusoids and supported by network of the reticular fibers. Chromaffin cells, so called from their color reaction to dichromate fixatives, as I have noted before, form part of the neuroendocrine system and are functionally equivalent to postganglionic sympathetic neurons because they are developed from the sympathetic system. They synthesize the store as a granules and release the catecholamines, noradrenaline or norepinephrine and adrenaline into the venous sinusoids. Release is under the preganglionic sympathetic control mediated by sympathetic neurons that occur either singly or in small groups in the medulla. The majority of the chromaffin cells synthesize the adrenaline and store it in small granules with a dense core. Less numerous noradrenaline secreting cells have larger granules with a dense eccentric core. Some cells synthesize the both hormones. It's the references for this lecture. Thank you very much for attention.